theoretical out of UC San Diego, and he came up with a novel idea to turn large amounts of complicated data into information that's easier to use. And our main focus is healthcare, although we do have solutions in law enforcement in the automotive area, principally, public safety driven solutions. But we got our start in healthcare, and that's what I'm here to share with you and talk about today. A couple things. Please don't hesitate to chat or ask questions, etc., as we go through this, because this is for you. I'm not doing this for fun. I'm doing it to share with you what we're doing, introduce you to some new forms of analytics, and answer questions. So please don't hesitate. Let me see, what else did I want to share? So before we get started, what I'm going to be demonstrating for you today is when we got started in healthcare, we developed a product that takes advantage of some data that the state of California makes available to hospitals throughout the state. By the way, Linda, before I go too deep into this, is this a healthcare class or? Okay, it is focused.
It is. Marketing and healthcare is the title of the class.
All right, perfect. Okay, so then I'll stay on track. So the state of California makes this data available to every hospital in California. But in order to do that, in fact, it's a legal requirement for every hospital in California to contribute their data to the state of California. So as a result, every hospital in California provides all their patient encounters, every emergency room visit, every inpatient discharge, and every ambulatory surgery encounter for every hospital in California is submitted to the state. And so it's a wealth of information across the whole acute care market in the state of California. And so what SpeedTrack did is we took this data that the state makes available and we host it in our platform, and we sell subscriptions to it to hospitals throughout the state. The data set used to be called OSHPD or OSHPD, but they changed the name of it a couple of years ago to HCAI or HCAI. And you can look it up, Google HCAI, and it'll come up, and you can get all kind of information on HCAI. And they do more than just make data available, but that's probably the principal thing they do. They also, well, I think that's all they do today. They split out another segment of what used to be OSHPD into another department. So I think HCAI, that's all they do is healthcare information. And so that's essentially what I'm going to be demonstrating for you today. A quick note, we've also integrated a bunch of other data. It's not just the state data. We have a lot of other data sources integrated with the data, in addition to our unique technology. And as part of our service, we will also provide analytics and reporting to our customers so they can do it themselves, or if they have additional questions, etc., they need help, they can call us and we'll help them with the reports, that kind of stuff. So are there any questions before I get started? And Linda, if you could help me monitor the questions and chat and stuff like that, because I have a tendency not to look at that, that would be helpful.
No problem. Sure, no problem.
Cool. Well, let's go ahead and get started. I'm going to bring up the SpeedTrack interface. And can you see this? Because sometimes when I share, Zoom doesn't share what I'm sharing.
We can't see it. We just see your cover page.
All right. I need to go to a new share, apparently. Okay. Now can you see it?
We can.
All right. Awesome. So let me describe what it is you're looking at. And this is our old interface. I shouldn't say old because it's the one that everybody's currently using, but we'll be releasing a new one before the end of the year, which is coming up really fast. So what you're looking at here is the underlying HCAI data that I described. And you can see up here, if you follow my cursor, we've got ambulatory surgery data. We have about 10.5 million patient encounters there. And this is for every hospital in the state of California. We have about 60 million ER visits, and we have over 18 million inpatient discharges. And if you look at the next line below that, we have it for years 2017 through 2021. They're about ready to release the 2022 data right now. So it's a little old, but it's still extremely valuable data. And we actually have another implementation of this particular application where we have 2022 and 2023 data for hospitals that are participating in that program. And essentially what they do is when they submit the data to the state of California, they submit it to us at the same time. So we get it early for hospital, and it's not for every hospital in California, but there are several. There's over 100 of them within the state of California that participated in that are participating in that program, and we're growing that dramatically as we speak. So down below, if you look in the lower left-hand corner, you can see there's a total of over 88 million patient encounters in the platform. And that's if you sum these three numbers up here, they equal the 88 million, or if you sum the 5 years worth of data, they all equal 88 million. And then down below that, you can see I'm in the market share dashboard. And in the market share dashboard, we have these categories. For example, facility name is what we call a category. And it's just a list of all the field values in these underlying data sets. So for example, each one of these data sets has a field in it for the facility name or the hospital name. We just integrate all those facility names into a single list. And you can see there's 499 facility names. They're listed here in descending order of frequency, which is the number of patient encounters at each facility. So without even doing anything, you can see information associated with all the hospitals. You can see which hospitals had the most patient encounters over this 5-year period, which cities and communities the greatest number of patients came from, the zip codes they came from, the counties they live in, what type of insurance they have. And by clicking in these other tabs, you can see other information associated with all the patients. So here's their sex, race, ethnicity, age ranges. If you're not familiar with it, what MSDRGs are, you will become familiar with it as you get deeper into healthcare. MSDRGs are a categorization that hospitals use for inpatients. They only apply to inpatients. They do not apply to ER visits or ambulatory surgery visits. But essentially, it's a way to categorize the type of service the patients have when they're in the hospital, whether it's a hip replacement or some kind of a cardiac procedure, et cetera. So Medicare can decide how much they're going to reimburse the hospital based on those inpatient stays. So it's the same across the country. They do make localized adjustments for those reimbursements based on local economic concerns within those locations. But in a nutshell, what MSDRGs are is, again, they categorize the inpatient stays. So whether they're pregnancy and childbirth or some kind of disease or alcohol drug use issues. Here's the codes. So there's 27 different diagnostic categories. There's 789 different codes. And here's all the codes with their descriptions associated with them. Here's all the families associated with those codes. And then down below, we roll up all the codes into these different categories. So if I click on, let's say, diseases and disorders of the digestive system, everything changes. Here's the 80 codes associated with them. Here's the descriptions. You can see they roll up into these service lines. Gastroenterology is number 1, general surgery, et cetera. And by the way, this is an example of how SpeedTrack works because it guides you through the data. So every time I click on something, the entire information space changes to reflect back all the information with it. So with 2 mouse clicks, I identified every patient that had an inpatient discharge associated with digestive system disorders. And in this case, there were major small bowel and large bowel procedures. And if I come over here, this gives me a breakdown of the patients, their sex, race, and ethnicities that had those procedures. And by the way, notice that now I'm looking at 75,000 patient encounters rather than 88 million. So with 2 mouse clicks, in a couple seconds, I went from 88 million down to these patients. Here's the hospitals that they went to. Here's the cities and communities they live in. You can see that 711 of them were homeless, which is the largest cohort by zip code, which is kind of interesting. I would have never guessed that. The counties they live in, the type of insurance they have, mostly Medicare, et cetera. And I can click across all of these different tabs and see everything associated with these patients. So I just illustrated to you what sets SpeedTrack apart to other analytics systems. Number one, it's extremely powerful and fast. And number two is it's very easy to use. If you can click a mouse, you can do very complex analytics and discoveries in the data. Are there any questions so far? And as we go through this, I'll start tailoring it to some marketing use cases, so you can actually see how hospitals use it for marketing and strategic planning purposes. But any questions so far? Awesome. Like I said, please feel free to ask questions as we go through this. So as I said, now watch this, look at this. I said that MSDRGs only apply to inpatients. So I clicked on an MSDRG, and when I look at the market share dashboard, you can see that this category that's associated with ER visits is blank. That's because I clicked on things that are only associated with inpatients. So the type of payer or insurance, payer is synonymous with insurance, it's only showing it for inpatients. Let's go through some more of these tabs. I'm just going to click on Start Over so we can look across all 88 million patient encounters. I see we have somebody else. Oh, somebody just raised their hand. How do I deal with that, Linda?
It's Madison, go ahead. I can't see it because of your screen.
Oh.
I see it down at the bottom now. Madison,
me.
go ahead.
Go ahead, Madison.
I just have a question. Are you able to touch more than one at the same time, or just one at a time?
Oh, that's a great question. Yeah, in fact, let me show you. Yeah, we can touch more than one at the same time. And let me first of all give you a little bit of background. So what Madison is asking, if I click on something, you can see that everything else disappears. And the reason for that is a patient can only live in one county at a time. So when I click in Orange County, all the other counties disappear, or they can only live in one zip code at a time, or they can only go to one hospital at a time. So every time I click on one, it only shows those things, but you can look at more than one at a time. And so let me click on Start Over and I'll show you what I mean. So for example, if I want to look at San Diego or Orange County, and notice I said San Diego or Orange County. I don't say San Diego and Orange County. And the reason I do that is because patients can't live in both San Diego and Orange County at the same time. I'm either looking at patients that live in San Diego or patients that live in Orange County. So you can see there's 6.2 million in San Diego, 5.6 million in Orange. So what I'm going to do is I'm going to hold down my control key, click on San Diego, then I'll click on Orange, and I'll release my control key. And now I've selected all the patients from San Diego or Orange County. And you can see down here, the total is almost 9 million patients, which is the total of 6.2 and 5.6. So that's one way I can select more than one at a time. Another way I can do it is, for example, if I have these zip codes here, let's say I want to pick the top 5 zip codes that patients came from San Diego or Orange County, and they're sorted in descending order of frequency. So the top 5 are right together in a range. So rather using my control key and clicking one at a time, I can just hold down my shift key and click on the first one, 2, 3, 4, 5, click on the last one. And then when I release my control key, it'll pick those top 5. So with a couple mouse clicks, I selected almost 1 million patient encounters out of 88 million from San Diego and Orange County for these top 5 zip codes that include these communities: Chula Vista, Anaheim, San Diego, and El Cajon. And they went to these hospitals. So any questions so far? And first of all, does that answer your question?
Yes,
Madison?
thank you.
So I'm going to show you one other thing, because sometimes, people will have a list of things that they want to look at. And just give me a moment here, and I will show you how we do that. Let me see here. Okay, what I'm doing is I'm opening up an Excel spreadsheet. Let me see here. And it's got a list of ICD-10 codes in it. Let me share so you can see what it is I'm doing. And so I have a list here of ICD-10 codes. And if you're not familiar with them, these are the codes that healthcare uses for diagnoses. And so each one of these codes is associated with a particular diagnosis. So what I'm going to do is I'm going to copy all these codes just by using my shift copy thing in Excel. And you can see I've got over 1,400 codes here. So I'm going to copy them. And then I'm going to go back over to the SpeedTrack interface, which probably means that, here we go. I'm going to have to reshare. By the way, have you been able to see what I just did?
Oh, Sandra's got a question when you get a chance.
Yeah, go ahead. Please, Sandra.
Hi, yeah, so who can access this data? I think you mentioned something like it's a subscription based for hospitals, or
Yeah.
can researchers or student access it, or how does that work?
Actually, the one I'm showing you here is for Cal State Long Beach's use. So this actually isn't real patient data, because I could get in trouble for showing you real patient data. But what we did is we created fake patient data from the actual application. So this looks exactly like the application. It's got all the features that the application has in it. You won't be able to tell. Obviously, it has real hospital names, but all the underlying patient data is fake. So yeah, you guys have access to it, and Linda can help you with that.
And to the real thing, they have to work for a hospital that has a subscription, right?
Yeah, that's right. So if you want to use the real actual application, you have to work for a hospital that has access, one of our customers, in other words. And then you have to get access through them. If you're in the analytics department or something like that, you can get access to it. And if you work for one of our customers, I can certainly help you do that. Feel free to go to speedtrack.com. And this is for everybody. And you can go to the contact area in speedtrack.com, and feel free to send me emails through the website if you have any additional questions, or if I can help you with anything. Don't hesitate to reach out. Does that answer your question, Sandra?
Yeah, thank you so much.
Yeah, you're welcome. So what I did was I copied those ICD-10 codes, and now what I'm going to do is I'm going to come over here to the diagnosis dashboard, and I'm going to put my cursor in the diagnosis code group. I don't know why this is taking a minute to update. It should be instantaneous. Probably has something to do with Zoom taking up bandwidth. That is weird.
It's probably because it involves me and technology.
Yeah, that was really weird. There we go. So I'm just going to paste into the diagnosis code group all those diagnosis codes. Now what it's showing me is some of them are invalid codes. So I put 1,400 in here, and so it's telling me that some of them are not valid codes. And that's okay. If I want to copy the invalid codes to research them later, I can, or I can just apply the valid codes. I'm going to apply the valid codes. It's going to run that query on the codes that were valid. I can see that 1,300 of them, 1,388 of the codes were valid. And now here's the diagnoses associated with those codes. And if I mouse over them, I can see that a lot of them are associated with breast. In fact, all of them are associated. Oh, that's neoplasm. These are all different types of cancers. And if I look down here in the diagnosis classifications, it says there's secondary malignancies, there's breast cancers, respiratory cancers. These are all various types of cancers that these ICD-10 codes deal with. So you can see I just did a very large, complex query with 1,400 ICD-10 codes and got immediate answers. And just like everything else, when I click on the other tabs, it's going to show me all the information associated with these patients. And this is pretty powerful. So let's say I'm interested in Torrance Memorial Medical Center. I'm doing a cancer analysis because I want to put together a marketing plan for Torrance Memorial Medical Center. And this marketing plan is geared specifically for cancer patients. So what I want to do is I want to find out where those cancer patients are coming from. Are they males or females? How old are they? I want to find out all this information so I can tailor a marketing plan specifically for cancer patients. So I'm going to go ahead and just walk down that path, and I'm going to let SpeedTrack guide me. So let me tell you what I mean. So first of all, I've already identified all the cancer patients. So I'm going to go to Torrance Memorial. I'm just going to click on Torrance. And here it's showing me the cities and communities that those patients come from and the zip codes they live in. So to start off with, I'm just going to say, in fact, let me do this. I'm going to bring up another Excel spreadsheet. Well, I'm not because, well, yeah, I will. This is because I have to keep switching back before, but in fact, let me do this. I'll just bring up the one I did a moment ago. And I'll just add a tab to it. So let's see here. You can't see my Excel spreadsheet right now, can you?
No.
All right, let me share it. That's cool.
I know it's very agitating when it does that. It does me the same way.
It's strange because it doesn't do it on mine. Anyway, let's just deal with it. So here's the Excel spreadsheet that I just brought up. And so what I'm going to do is I'm going to go back to the SpeedTrack application. And I'm going to copy those zip codes and I'm going to put them in here, and then I'm going to analyze those zip codes. So let me just do a new share. I'll go back to the SpeedTrack application. I'm going to right click in the zip code, and this, you don't have to remember all this stuff. If you want access to this and you want training on it, then we can do training. But I'm just going to go through this very quickly. I'm going to copy it. I'm going to go back to the spreadsheet.
Oh, Naomi has I have trouble with her name. Has a question for you.
Sure. Go ahead.
Yeah, I cannot see on my end. The screen is been frozen for a while, so I don't know if other student can see what you're doing. But on my end, it's just Los Angeles homeless people.
Wow. Yeah. Thank you. Thank you for letting us know. Is anybody else having that same problem?
I'm having a similar issue.
I see Kaiser Foundation highlighted.
Oh, wow.
Yeah, Kaiser Foundation one, and on the other side is like patient county is like Los Angeles, and patient zip is homeless.
Yeah. Okay. Yeah. Your screens are frozen. I'm not sure why. Thank you for letting me know. That's really strange. All right. Hang on.
I was looking at the students with their hands up and I didn't see that. Sorry.
Let me see if I can reshare. Yeah, thanks for letting me know. God, I could have gone on for the whole class. Okay. Can you see? Gosh, yeah.
Torrance Medical Center.
Yeah. Okay. So let me back up. In fact, let me just do this over again. We have a lot of time here. So I'm going to take these ICD-10 codes. Let me just bring up that. Here's the ICD-10 codes. You probably can't see those. Okay. Can you see this Excel spreadsheet?
Yes, we can.
Okay, I've got these ICD-10 codes highlighted. I'm just going to do a Control C and copy them. Then I'm going to go back to speed track. It says my screen is paused. I didn't pause it. Why is that? Okay, tell me this. Can you now see the interface?
Yes, we see Kaiser Foundation again, Fontana.
Okay. So I'm going to come back over here to the diagnosis dashboard, and here's the diagnosis codes. I'm going to paste them right in here. And so this is where it's telling me that here's some unmatched diagnosis codes. So in other words, those were codes that were bad codes that I pasted in here that don't match anything. Now I can copy these codes so I can research them later, or I can just apply the ones that are valid. I'll apply the valid codes, and I can see there was 1,388 valid codes. And you can see that these all have to do with cancers, secondary malignancies, breast cancers, respiratory cancers. And by the way, if I want to focus on breast cancers, if I click on that, you can see that these are all associated with breast cancers. There's 59 different breast cancer codes. If I widen this, these all have to do with breast cancer. So now what I was saying is, let's say Torrance, you are hired to do a marketing study for cancer patients for Torrance because they want to put together a marketing program to bring in more cancer patients. So I've identified all the cancer patients for every hospital in California. All I have to do now is focus in on Torrance Memorial. Now I can see the cities and communities these cancer patients live in, the zip codes they live in, what type of insurance they have. We're going to focus on inpatient cancer patients. So I click on inpatient. And now what I want to do is I'm just going to identify the top zip codes. And so this is where the Excel spreadsheet comes in, because I want to analyze these zip codes. What I'm going to do is I'm going to right click, I'm going to copy these zip codes, and then I'm going to bring up the Excel spreadsheet by doing a new share. Let's see here. Where's it son of a gun? Oh, I think I know why. Here we go. Oh, that's not it. I cannot find
Here
it.
again.
Oh, you know what? Maybe I need to do this. Yeah, I can't find it in my sharing stuff. That is so weird.
I have that happen to me pretty often, and I have to go find it on my desktop, wherever it's at, and click on it so it's back in the screen.
Yeah, it just isn't even showing it at all.
Jeez. I'm afraid the voodoo technology that I have on me is rubbing off.
Well, the weird thing is I do this every day in Zoom. And for some reason, the Zoom that you guys use isn't configured so I can see all my screens. And anyway, there's nothing I can do about it. I'm not going to waste time with this. Let's just stick with the SpeedTrack interface. And so what I was going to do is I was going to copy and paste these zip codes into Excel, and I was going to total the percentage of people with cancer that went to Torrance up to 70% of these patients. So let's just say that these zip codes here equal 70% of the cancer patients that go to Torrance. The reason I do that is I want to identify the geographic area that most of these patients are responsible for, that are covered by Torrance Memorial. Now, when I clear the facility name associated with Torrance Memorial, I can see that Torrance has 36% of this market for cancer patients that come from this zip code that are associated with Torrance. Little Company of Mary has 19% and then on down. So Torrance already has the majority of this market, but it's still far less than 50%. And if I want to see what that looks like in a map, I'm going to click back on Torrance. Again, I'm just looking at these 13 zip codes, and I'm going to click the map button down here, which means I'm going to have to reshare my screen again. Let's try this. Okay, let's see. You share. Oh, here we go. It is showing the map. So it created this map of the zip codes, and it's showing me where the most of these patients are coming from. They're coming from these zip codes down here. And I can change, this is per 1,000 population for the zip codes. But if I want to look at the total, they're from these 2 zip codes right here. But either way, we're going to focus on these zip codes, and I can put this map into a report if I want to. Now let me go back to SpeedTrack interface, and we'll just stay here for a while. So I've identified that. I can see where else these patients are going. Now let's focus on the breakdown of the patients from all that go to all of these hospitals, not just Torrance. I can see that they're 50-50 male and female. I can see that they're mostly white. I can see that they're typically over 65, or at least over 35 and 65 years old, 35 to greater than the greatest. And I'll focus on those. And now I can see the cohorts. The biggest cohort is white males greater than 85, followed by white females greater than 85, and then on down. I can see that they're mostly diseases of the circulatory system, or cancers that affect the circulatory system. And, you know, they have service lines, which are defined by the DRGs, between cardiac services, general medicine, and orthopedics. So I get all this information. And if I wasn't talking, I could have done this in less than 5 minutes. And now with this information, I can start assembling my report. So if I want to put any of these things in, I can just click here, the trash can. I want to be able to show in a PowerPoint presentation that, you know, here's the age ranges we're talking about. I can just right click, copy, paste this graph into a PowerPoint. I can show the ethnicities, put this. I can show that it's, you know, 50-50 between sex. I can create a report on the males and females. I can come over here and say, well, what kind of insurance do these people have? Mostly Medicare. And then I can say, well, if it's mostly Medicare, what type of Medicare is it? I can see that, you know, 50% of it is fee for service or traditional coverage. And another 44% of it, 45% of it is managed care. And for the managed care contracts, I can click on that. I can see that 20% of them are Kaiser, another 20% of them are UHC. So you get the idea. So what I want to emphasize is what would used to take an analyst several weeks to do, we can do it in a half an hour. And you can have this in front of your executives the next day. And actually, in the meeting with the executives, you can bring up SpeedTrack and have them ask questions like, well, you know, it's about 50-50 male and female. What kind of cancers are affecting females most? I can come over here. Well, let's look at that. Let's just click on females and come over here and look at the types of cancers that are affecting females most. And it's secondary malignancies followed by breast cancer. What are secondary malignancies? Let's focus on secondary malignancies. And if I scroll down here, Number one is respiratory system malignancies, as you can see here. If I widen this. Oops, I sorted that the wrong way. Which is over 65%. Actually, respiratory and digestive organs, followed by unspecified, and then lymph nodes. So anyway, you get the idea. I can do some very in-depth analysis very quickly. I don't have to know how to write SQL codes or query code languages or be a programmer. I can just know how to click a mouse, be familiar with the underlying data, work with my colleagues by bringing up SpeedTrack and working together, and I can get very important answers very quickly. So that's an example of a marketing case study. And then the next example is, let's say, hey, we want to put together a marketing plan to focus on females with breast cancer. And so you can do that. But the other side of the coin is, from a strategic planning perspective, do we have the operations to support females with breast cancer? Do we have the physicians? Do we have the counselors to really support a marketing effort associated with breast cancer? So that's the strategic planning question you need to explore. Do we need to hire physicians? What do we need to do to create the operational infrastructure to address doing a marketing plan associated with breast cancer in our community? And we can do both sides of that coin, right? So obviously we talk to the clinical side and find out, do we have physicians with experience performing breast surgeries? Do we have the technical staff, either technicians and operating nurses that are operating room nurses that are associated, have experience doing these types of surgeries? Do we have the counseling staff that can counsel these women when they come in? All of those things, those are questions that need to be asked, and you need to get the infrastructure in place. Or are there special, like robotic surgery machines that we need to pay for, that we need to buy to support these types of surgeries? Those are all the types of, actually it's not all, but those are some of the types of use cases that we run into. Any questions on any of this stuff that I've shown you so far?
You know, it looks like to me there'd be a great potential for, if you're trying to grow your business, you know, you can see where the need is the greatest, and then look geographically where it seems like some of the people that are going from these zip codes are going a long way, and maybe you're closer. You know, it seems like that this would be a way to look and see where there's a need.
I'll tell you what, we just got a use case from a CEO up in Northern California from Shasta Regional Hospital. He wrote a use case for us on how his team used SpeedTrack to do exactly that. I'll send it to you and you can share it with the class.
Okay.
So you can get an idea. And that's a perfect use case for us.
Okay, super. Every time I look at this, I'm just amazed at what it does. And I'm, you know, my brain is working like, wow, you could use it for this. You know, the researcher comes out, you know.
Absolutely. We, our customers just love us. We just need to get more of them. So
Right.
if you guys happen to work at hospitals or know of people that do, shoot me an email through our website and I'll follow up with you. Or if any other questions you have, of course. I'm going to transition over in one more use case here, and then I'll show you some of our new applications. So, you know, I've been focusing on inpatient, but, you know, some of the ER stuff is also really important. Does anybody have a favorite hospital they would like to take a look at?
Cedars-Sinai.
Why does everybody pick Cedars-Sinai? I don't know why that is. Literally every class. Okay, so we can look at Cedars. Let me just start typing Cedars. Actually, here it is. I can start typing it here and find it as well. I haven't shown you that yet. So there's Cedars. And so let's focus on their ER. So with 2 clicks, I'm looking at their ER. And what I want to do, look at DRGs, I'll go to that dashboard. They don't apply, like I said earlier. They're blank for ER. but I can come over here and obviously I can see the patients. This is pretty typical. Depending on where the hospital is located, obviously the race and ethnicity is going to vary dramatically. You know, we do a lot of work with Martin Luther King, and obviously their race and ethnicity and their age ranges vary. And obviously the location where they come from is going to be different. But let's focus on homeless patients that go to Cedars-Sinai. And again, you know, you can see the difference here. They're mostly male. The African-American population increased dramatically by doing that. Here's the cohorts. Most of them are white males in the top cohorts, over 50 years old, or at least over 40 years old, as in most of them, or at least the lion's share. Mental and behavioral neurodevelopment disorders. If I come over here to the diagnosis dashboard, and we haven't focused on this yet, but diagnoses and procedures are different because unlike zip codes and cities and hospitals, a patient can have more than one diagnosis at a time. And so the way they categorize this in healthcare is you can have one principal diagnosis. So you can see all 11,548 of these patients have one principal diagnosis. All of them have one in other ones. And then they can have secondary level diagnosis. There's 1 through 24 different secondary levels, but they all have one principal diagnosis. So if I want to understand, I'm Cedars-Sinai, and I want to understand the homeless population that's frequenting my hospital and what their principal diagnoses are, I can just focus here, their principal diagnoses. Obviously, another, if I scroll down here, we've rolled up all the diagnoses into these diagnosis code groups and these body systems, mental behavioral things, which is interesting. The number one classification is musculoskeletal pain. Pain's another big one they come in for, but you can also see the mental disorders and substance abuse disorders that they tend to have. And you can prepare and actually put together strategic plans. How do we serve this homeless community? What are their needs? We don't have zip codes on where they're coming from because they don't have a zip code. They're homeless. So we can't do it from a geospatial perspective. But the other thing we can do is, so for these, we can come up, this is something interesting that the hospitals use a lot. We have what's called a unique identifier associated with each patient. And so I can see I've got 4,100 unique identifiers. 12% of them are blank. What these are is actually at the hospital level, these are going to be Social Security numbers associated with these patients. But what the state does is they transform them into these unique codes. So we can't see any personal information associated with these patients. But I can see this patient right here has had 191 ED visits, ER visits at Cedars-Sinai over this since 2019. So if I want to focus on, let's just pick some of these patients that have had, over 50 ED visits at Cedars-Sinai over the past. And now I can get an idea of who are the chronic users of our ED. Look at COVID was a big one. And now I can come over here and I can say, well, where else are these homeless people going that have been to our emergency room? So if I clear Cedars-Sinai, are they going to multiple EDs? Yeah. There was 265 encounters from those patients, those homeless patients that went to Kaiser Foundation in West LA. There was 81 visits at Kaiser LA, another 32 at UCLA. So you can get a pretty good idea of where they're going, what kind of services they're getting within the EDs, and put together strategies on how can we better serve these people. And the idea is to make sure they're in better health, to keep them out of the emergency room. Because what happens is, they shouldn't be in the emergency room for these types of things. You saw a lot of them were mental health issues. They should be getting care for mental health issues, specialty care, or they have addiction issues, things like that. So this is another very common use case we see with SpeedTrack. And I could go on and on. I've probably got 20 other use cases I could share with you guys today. But we're running out of time. So are there any final questions? Let me see.
I have a question, and
Yeah.
I don't see it in here, and I'm sure it's because y'all don't get the data, but do y'all have any kind of division for like veterans? Because it'd be curious to see, you know, with a lot of those diagnoses I noticed were common, you know, among veterans. Do y'all have that?
No, we don't. We don't have anything directly. You know, indirectly, you can sometimes look and see if they have any kind of a veteran insurance program, but obviously that isn't very helpful. So no, we don't. There is nothing like that in the data.
I'm sure that probably they probably don't ask that, so you can't get it when data's not given to you, you know.
Right.
So, but I was just like with the VA, are they part of y'all's system, or can you even tell
No,
me that? No,
VA
okay.
does not have to provide their data to the state, so they don't. So
Okay.
I should have mentioned that up front. We don't have any information from the VA hospitals. I noticed we do have a couple questions. If you could,
Oh, I see. Yeah, Brandon.
yeah, Brandon, Naima as well.
So it's a pretty powerful tool. Have you implemented anything with AI? Because that's the new big thing, right? So
Yeah, that's a great question. And that's number one in our development roadmap right now. And just to give you a little high level, because I can't share any intellectual property, obviously you have a little technical interest. So because our backend is very different, we invented it. Nobody else uses a backend like ours. Just to give you without getting technical, essentially what it's based on is matrices. Rather than storing data, we store associations between every data element. In this case, we're looking at 88 million patient encounters. We have implementations with over 1 billion patient encounters. And so clearly it's very powerful. But the key thing from a predictive or an artificial intelligence perspective is we know every single association between every data element. And this could be letters in words and sentences. We know how they're associated with the words. We know how they're associated with the sentences. We know how they're associated with those documents that contain those words. Every level of association and every piece of information is stored in our matrices. So without sharing too much, imagine what you can do from an artificial intelligence perspective with that kind of knowledge at your disposal. And I should have shared this up front, but the physicist who invented the system, he based it on it by modeling the human brain. So yeah, we're very focused on artificial intelligence right now.
that's really interesting.
Great question. Thank you for the question.
Okay.
Naima.
Yes, it's a very impressive, the whole thing is. You said this is like our fake data that we can use for our academic purposes, right?
Correct.
If we want to have some analysis done for our academic research. How can we get to this? I logged onto your website, you said speedtrack.com, but it's just straight email or
Yeah.
straight website. And how can I get to this level where you're
This is actually hosted by Cal State Long Beach. So it's through their student portal or whatever it's called. And you would have to talk to Linda on how to get access to it. So I don't know, but we just make it available to Cal State Long Beach, and they can help you get there. I will say, I told you this is the old interface. You have to have some software on your computer to use it. You have to have some Java software, but it's not a big deal. You just have to download it on your computer. Then you can use SpeedTrack. I mentioned that we're transitioning over to a fully web-based system by the end of the year. Let me just give you a quick example of what that looks like. It's very similar looking. By the way, if you have follow-up questions, Naima, go ahead and keep talking while I'm doing this.
No, just this. Because sometimes we have to get some data analysis, and online is just we have to go through a lot of websites to look for the data. But if we have something like this, we can get our data
Oh,
straight
sure.
from here.
Yeah, and if you have any trouble getting access at Cal State Long Beach, shoot me an email through the website and I'll help you get there.
Thank you.
Of course. Thanks for the question. I've got to run here in a minute, Linda, but are there any final questions or comments before I jump?
Well, thank you so much. This has been very informative. I can tell the students are engaged with this, and you know, and as they always are, and as I am every time I see it. So thank you again so much, and I'll be reaching out again next semester. My evening class gets to watch the recording of this. So,
Yeah.
but thank you so much. I really appreciate you coming.
It's my pleasure. I'm happy to do it. I'm glad we could get this figured out this morning. Have a great day, everybody. Thanks for your time, and feel free to contact me through the website if you have any follow-ups.
Okay, thank you.
Thank you.
Bye-bye.